Hello and good afternoon. As promised and advertised on the MindPath Care Center's Facebook page, we are live this afternoon. I would like to thank you for tuning in to this MindPath Care Center's live Facebook event. I am Dr. Shantel Sullivan, a licensed clinical social worker and the lead therapist at the MindPath Addiction Recovery Center. I wanted to start today by reminding you that everyone, we're in this together and we will get through this together. I was just talking to one of my colleagues and he reminded me that there is a beginning and a middle and an end to all of this. And we are currently living in the middle and learning new things, but there will be an end. And hopefully it's upon us sooner than later. Um, MindPath, our entire clinical team, is here to support you and your mind care during this unprecedented time. We are offering telehealth services or telemedicine, and most of our providers have converted by now, if not all of them. And certainly they are accepting new patients. So don't delay. You can connect to a provider in the comfort of your home. And as one of those clinicians who've moved to telehealth, I have to just share that I'm enjoying it, and I find that the people I get to speak to day in and day out are enjoying it as well, and it's not as intimidating as you may think. Um, so today I really wanted to talk about and cover how we can address what's going on emotionally for all of us, most likely all of us, during this COVID-19 pandemic. At this point, if you're feeling anxious, I just want to remind you you're not alone. Feeling anxious is a normal instinct and it is a survival skill. There's a lot of unknown right now, and so that is triggering these thoughts and emotions of concern and fear, if not just for yourself, for your loved ones. And in addition to these healthcare concerns, our routines and the events that we were anticipating and looking forward to have been interrupted. And those significant upsets, or upsets like this particular one, can conjure up feelings of disappointment and letdown. It's important that during this time we honor those feelings. We don't need to push them away or ignore them, but just acknowledge that this sucks. This isn't what I expected. This seems unfair right now. Acknowledge I'm scared. I'm bored, right? Just acknowledge what is happening. And through that, acknowledging what you had planned or what you had been hoping for has been interrupted, we can then start moving forward. But it's important that, in addition to finding new meaning and adjusting to this new normal, that we do take this pause and allow ourselves to feel and acknowledge this disruption. Then, and only after that, we can begin to find new ways to restore, reinvent, and re energize. So, today I'd like to share a couple of strategies that I might recommend for you to deal with this current situation, or you could also use in the future if you come up against added stress or crisis. After I share these three options or strategies that you might want to practice, I will offer some time for question and answer. And when we get to that point, what I'll have you do is write your questions in the chat box, and then I would be happy to answer them for you. So the first strategy that I would recommend is it's important to breathe. Knowing that breath is life. Oftentimes, we're just going about our day and we're breathing in survival mode because that's what we do. Really, sort of unconsciously, we're breathing. And so, in this time of added stress, what we can do is pay more attention to and be aware of our breath. So, if you find that you are frequently feeling stressed or anxious, learning to breathe from your belly will significantly decrease the stress in your life. You can practice this by placing one hand over your heart and then the other hand over your belly button. And you can take a little bit of an inventory and noticing, are you breathing from your chest Or are you belly breathing? Take note of which hand tends to rise and fall more than the other. If you notice that that's happening in your chest, you will notice that these breaths tend to be thin and more narrow. And so, therefore, we are just taking these shorter breaths. That doesn't really help support grounding us or reducing some of that anxiety. So, what I would encourage you to do is when you're getting ready to prepare dinner, or before you take a shower, or you turn on the next episode of your favorite Netflix binge right now, put your hands over your belly button and just try to work on noticing this intentional breath of your belly. As you take a deep breath, your goal will be to notice your hand over your belly button moving up and down. Again, breathing is really important. And so the more we can take time to pause and take a full breath, it will help us to reduce our anxiety and our stress. The second option that I would offer for you, or the strategy I'd recommend, is using present moment awareness through mindfulness. So there's a lot we cannot change right now. There's a lot we cannot control. But what we can do is be mindful. And so as you go through your day to day, or you're engaging in tasks that become really complacent or mundane, like getting up and showering and making our breakfast, or pouring our cup of coffee, or cooking dinner. What we can really do during that time is develop a new heightened curiosity in these experiences. So while you are taking a shower or washing the dishes, allow yourself to notice the temperature. How hot is the water, right? Or how cool? What temperature are you noticing? What sounds? Hearing the water falling in your shower, or the trickle from your fountain, or whether it's a really full push of water through your faucet, just taking note of that. Notice the scents. Again, this will help with your breathing, really taking a nice deep cleansing breath through your nose and noticing the scent of shampoo that you're using, or the dish soap that you're using, or as you are cooking dinner, take a breath and notice the fragrance of whatever food you're cooking. But just allow yourself to be present in the moment, and notice your surroundings, right? What you can touch, what you can feel, what you can hear, what you can smell can be really helpful when things are feeling like they're really out of control. The third thing that I would offer is to be kind to yourself. We didn't ask for this. It's happening to everybody, regardless of our race or socioeconomic status or geographical location, our gender, our age. So it's important to be kind as we are asked to make transitions to working in ways maybe we've never worked before, or we are taking on new responsibilities and roles in our family or with our friend group, or we are moving to states of being alone or in isolation. Be kind. We are juggling a lot right now. And so it's important that we make an effort to be gentle in our thoughts and practice being judgment free of self. We are really doing the best that we can right now. And so affirming yourself, and being kind can really go a long way. Again, we are in the middle, but we will get to the end, and we will get to the end together. And at MindPath Care Centers, we're here for you, and we want to be part of this journey, not just now, but as you continue to move through your life and the weeks and months ahead. All of these things also take practice. So again, be kind to yourself. They may not come really naturally to you, and they might feel funny, and you might wonder, why am I doing this anyways? But all of these are strategies for you to develop new skills and ways for wellness. So I hope these three strategies of breathing and being in the present moment and really aware through mindfulness in your day-to-day tasks, and being kind to yourself will help you on your way. So what I'd like to do now is just take some questions that you might have and offer you some feedback about how you can navigate new roles, whether that is working from home or being in your home more than you typically would, or any shift in activity or relationship in your life. So go ahead again, and if you have any questions that you would like me to answer or help you with, or offer some feedback, go ahead and put them in the chat box, and I will see them pop up and we can discuss them. Hmm. Okay, so one question that has come in is says, people keep suggesting to focus on the positive and find gratitude, but I'm having trouble doing that. Do you have any recommendations? Um, that is a great question. And, one I have to even ask myself when days get hard, right? How can we find gratitude? And so, one of the ways is thinking about time. Right now, you may have the time to engage in activities that life just became too full and too busy for you to fully do. And so, picking up a hobby or an activity that you haven't done in a while might be something fun, and finding just gratitude. And now you have the time and space to do that. When we're faced with difficult situations, it is hard to find gratitude, but it's there. Um, if you have friends to reach out to, you could even ask them, hey, what are you grateful for today? What's going well for you? That's one way for you to connect with people, but also you can get some feedback and idea of what others are doing to find gratitude. And then maybe you might agree with that, or it would help validate something that you hadn't quite thought of. But again, there is a lot out there. I've noticed on social media, so much going on around ways to connect with people and expressions of gratitude through phone calls or messaging. Um, my sister lives in upstate New York, and the 518 area code was placing rainbows. And I know that's happening sort of more worldwide. But, I'm grateful for the other day I got to just paint some rainbows in the window with my kids. And if I wasn't working from home or being home more, I might have missed that opportunity. So I'm grateful for the connections or new connections that I've been able to make just because I have a little bit of time right now. Uh, Another way to find gratitude is, just looking out the window and being able to see if the sun is shining. Um, it might be really small things that if you're having a really hard day, I woke up today. Maybe I'm grateful for that. It does take a little bit of effort. And again, if you're having challenges doing that, sometimes asking a friend how they're finding gratitude or what they're grateful for can be helpful. Okay, so another question is, what kind of activities do you recommend to help those at home to reduce stress? So we've talked a little bit about breathing. We've talked about using mindfulness in your day to day. Some actual strategies you could use in addition to that would be going for a walk. We know right now that we can continue to practice social distancing and get outside. So if you have a walking trail near you, or if you have the privilege to have a backyard or a balcony, sort of getting outside and breathing some fresh air, and enjoying the nature around you can reduce stress. Another thing is cooking, um, drawing, coloring. I talked to somebody yesterday through telehealth who was sharing with me that she spent much of her day coloring pictures, and it brought back some memories of her childhood and just, oh my gosh, when was the last time that I actually just spent hours lost in a coloring book? So we know coloring can be helpful. Um, Exercise. So right now, because gyms are closed and fitness centers are closed, lots of gym owners or fitness instructors have moved to some YouTube platforms. And so there's a plethora of classes that you could join from the sort of privacy and comfort of your living room to still get out um, some of that added tension and stress you've got going. You know, move a muscle, change a thought. And so if you can get a little physically active, that might be helpful. Another question I saw Roland says, do you have any tips about navigating the isolation? I found exploring my city, being near others, to be very beneficial for my mental health. And now I'm torn between going out to support my health while also maintaining distance to help protect others. Absolutely. So when we are dealing with some isolation, there is a benefit of technology in that if you have a way to Skype or Zoom or FaceTime, you can still see people like I'm live today and connecting. It's been great that a lot of museums have also offered free tours, virtual tours through museums, so you can look at art, or you could explore different historical venues that maybe you wouldn't go to on a regular basis, but now in sitting at home, you can take yourself virtually to a new location. But I think when we're feeling isolated, we have to work extra hard to stay connected to people. And so it might be through virtual platforms. Or even if, the other thing that might be great is using this time to write some good old snail mail. And that also allows you to get outside and get some exercise and fresh air if you are able to, and you're in a location where you could walk your handwritten piece of mail to somebody else and drop it in the mailbox and then wait to receive another piece of snail mail. That might be a nice way to connect. All right, so here's another question. It says, do I have any recommendations for parents who are coping with more time with their kids and a loss of personal freedom and flexibility? That is an awesome question, because yes, we are spending more time in the space and company of others. And so, one of the things that I might recommend also, if you're working from home or you're doing homeschooling right now, is as you are able, sort of fashioning different corners of your house or spaces within your living quarters, so that this is my workspace, and so I can make some transitions from this is where I'm going to work from home over here in the right corner of the living room, and then I'm going to shift over to the left side of my living room to read a book. And so then we are creating those really hard transitions from one physical location or another, because we don't have those hard transitions from our workplace to our home space. And so now where our home has been our refuge or a place to re-energize is now where we're just all the time. Or on the contrary, for some people who are trying to work outside of being isolated and in their home, now they're feeling pressured in those spaces. So again, taking pause to go out on the balcony. You could use an egg timer or your phone timer and say, okay, everybody, we're going to practice some personal, quiet, silent space, and each person can pick a space in the same room or a separate room um, to go for a timed amount, and just look at a book or look at pictures or scroll their phone, but create some really structured, intentional time to separate from one another. The other thing I might recommend is, I said being intentional and being mindful when you're taking a shower. If you're not rushing, like I know that I do in the morning, to quick get my shower in, get the kids to school, and get to work, now I could really spend that time taking in sort of the aroma of being in the shower, or washing my hair, or taking the time maybe to put on my favorite lotion on my arms afterwards. Um, you know, we can go to a silent space in our mind as we're stirring dinner, um, and taking a nap. If we need to take a nap, that can also be helpful. Yeah. All right, so I'm going to look for a couple more questions. Thank you for the questions that have rolled in. I hope that you can practice and apply some of these. Um, Last night I was offering a group therapy session through telehealth, and it came up, this discussion about, there is a lot on social media right now about people being super productive and doing these art projects and going for walks and trying a new hobby, etc. And so while all of that is great and that gives us opportunity to do that, and I've encouraged you to do that as a way to stay active and reduce stress, I might also encourage you to take pause and be kind to the fact that it's also okay to just be, right? And that every minute or every hour of your day doesn't have to be accounted for or have an activity plugged into it. That just sort of being present and going with the flow as much as you can right now is also okay. That you don't have to feel pressured by, or you shouldn't feel pressured by um, what others are doing, and really give yourself permission to just say, I think that we're just going to hang out today in our pajamas, and we're not going to try to get showered and figure out how we can be creative today. We're just going to be today. Um, and make that conscious decision can be helpful. Okay. And again, the other thing is, I think that, as we're working from home and juggling different spaces within ourselves and in our relationships with others, just to know that if you are feeling like you could benefit from talking to somebody, all of the clinicians here at MindPath are here and available to you. And we want to support you through this most unprecedented, difficult time. Um, so we are here and available. Feel free um, to make an appointment as you see fit, and that would benefit you. Sort of the last question that I just saw that came in is said, any advice for nurses on the front lines? Thank goodness. Thank goodness for those who have selected a career path and are so brave and courageous and caring to be out there combating this for us and taking care of our loved ones and our friends and people that we don't know. Um, I certainly would like to take a minute to thank all of those who are on the front lines. That's those working in the grocery stores and restaurants and in the healthcare or emergency management services, who day in and day out are putting themselves at risk um, for the benefit of you and me and our friends and family. And so the best advice that I could sort of offer or share is, know your own limits. Ask for help. Um, you know, I have written some articles and talking about that. One of the things with healthcare workers is, that's what we've signed up to do. That is our job, but that doesn't discount the fact that you're human and you are feeling anxious and scared as well. And so we hear you, we see you, we want to support you. Uh, One of the things that I think can be helpful is riding the wave of the emotions, acknowledging those emotions. Um, After that day, before you go from work to home again, taking a few minutes in your car even to just practice that deep breathing, ground yourself, affirm the fact that you are really contributing something incredible for the greater good of everybody. And we are so thankful to our emergency management personnel and nurses and doctors on the front lines. Um, but again, don't ignore your own feelings and your own humanity. And I've loved seeing nurses post pictures and videos um, and really rally for each other and for our communities. So thank you for all of that. So I have about 2 more minutes. And so if there's any other questions that anyone would like to ask, these are all great questions. Um, I really appreciate the feedback um, to what I've talked about and the questions that you're posing. I'm sure that lots of people are asking these questions or even maybe be afraid to ask these questions. And so I appreciate your courage in doing this for everybody. Um, Also, one last question. How do I balance being a teacher, working my job, and being a wife and a mother? Whew, I was just saying that the other day. I was saying, okay, right now I've taken on the role of uh, lunch monitor and teacher and uh, therapist and wearing all of these hats. And I think it all goes back to one, being kind to yourself and acknowledging that all of those are separate jobs and roles in and of themselves. And you don't have to be the best or perfect at any of them or all of them at one time. Allow yourself to take the time to really be mom or mother. Um, I saw the other day where someone said, instead of really grappling with how to figure out this math problem, um, we could teach our kids how to do the laundry. And so there might be a story later that we share about, oh my gosh, I remember during this COVID-19 thing, and I was 10, and you taught me how to sort my laundry and wash my laundry, and there's a huge lesson in doing that. Um, but it all goes back to being able to acknowledge the fact that um, we're taking on so much right now, and we have to be kind, and we can do the very best that we can. Be gentle and try to be non-judgmental of yourself is really, really important. Yeah. Thank you for all these great questions. I appreciate them. Um, I'm just scrolling down right now to see if there's anything that I've missed. How can teenagers cope with being confined to home? Certainly when that's a time of exploration, and the last sort of place you want to be all the time is home, is being stuck there. um, I think we have to be as creative as possible, calling people, setting up Zoom meetings or Skype sessions with our friends so we can virtually chat with multiple people at one time. I saw one of my high school friends um, posted a video of a birthday party. I've seen this a couple of times now, just in various platforms, where it's somebody's birthday and maybe they're really looking forward to getting together with a whole bunch of people. And we can't do that right now. And so everyone jumped on this Zoom meeting, and they still had a birthday cake, and everyone can sing happy birthday. Um, there was a patient sharing with me yesterday that they did the same thing for a coworker, that they had planned on having a cake in the break room, and no one's working at the office right now. And so they coordinated a Zoom meeting, and everyone sang happy birthday, and they connected. Is it ideal? Is it what we had hoped for? No. And so, again, going back to my first point, really acknowledging the fact that it's not what we had anticipated, but it is what it is right now. And I hate to ever put a silver lining around anything, and I'm certainly not trying to do that, but trying to figure out how we can do the best that we can with what we have at this present moment, and being creative and flexible and kind, I think is the best that we can do for ourselves and for each other, being flexible and kind to self and to one another. Thank you so much again for all of your questions. I wish you continued well-being or healing. And we are here to support you now and in the future. So please feel free to reach out to us and be well today. Thank you so much.